Welcome to episode 2 of the Longevity and Hormone Health podcast with me, Dr. Fareeha Rizvi, consultant in diabetes, endocrinology, and obesity medicine. Every week we discuss a case from a medical perspective and a holistic perspective. I have my co-host with me today, Sandra Spencer. Sandra, do you want to introduce yourself?
Yeah, hi, I am Sandra Spencer. I'm the founder of the Healer's Yurt, and I am a perimenopause, menopause, midlife coach.
Awesome. So today's case is one I think that many people will recognize someone in their own life. It may be, your husband, your brother, partner, friend. It's about men in their midlife. So this is a real case from my clinic. As always, I bring real life cases and we discuss the medical and holistic aspect. So this is a 54-year-old businessman. He's lived with type 2 diabetes for around 8 years. Over time, he has gradually gained weight. So from his 40s to his 50s, he's gained around 15 kilos. And his most recent weight in clinic was 110 kilos with a BMI of 39. So that's in the obese category. He also has high blood pressure, raised cholesterol, and early diabetic related eye disease. Most recently though, he has noticed low energy, reduced motivation, low libido, and blood tests that I did in clinic have confirmed low testosterone levels. In terms of his lifestyle, I mentioned he's a businessman, he has a desk job, he sits at his desk 10 to 12 hours a day, he has a very stressful job when he's at work, and he spends 2 to 3 hours every day commuting between Sharjah and Dubai. So anyone that lives in this region knows what a difficult drive that actually is. So the question is that simply what happens when we get older, when men get older, or is there something more that's going on, and how can we help this man? So firstly, when I saw him in clinic, I explained that none of these issues are occurring in isolation. They are all related. So as we've discussed before, there are modifiable things and non-modifiable things. So things that we can change about our health and things that we can't change. So things that we cannot change are age. So he's getting older, he's in his 50s. Age, ethnicity, genetics, so that kind of is related to family history. Age, genetics, ethnicity, those are the main ones, and gender, of course. Insulin resistance, diabetes, hormones, we consider very differently in men and women in around midlife. Things that we can change are modifiable risk factors. Those are things like diet, lifestyle, sleep, exercise, maybe specific things like fiber intake, intermittent fasting, types of exercise that we do. So we have to think about how we approach any disease in terms of modifiable and non-modifiable risk factors. So specifically about diabetes, so many of our listeners, our viewers will have heard about insulin resistance. Insulin resistance has not just been created for Instagram. It's occurring all over the world, particularly in this modern era of life where we have more sedentary lives, we're eating more often, we're eating more processed food, we're much less active and eating far more often than our ancestors before in any other generation. So when we eat that often and we eat processed foods or high rich carbohydrate foods, our blood sugar goes up, our pancreas makes insulin to control the blood sugar, and if the blood sugar keeps rising, insulin keeps rising until our pancreas can't make insulin anymore and the blood sugar rises above that. That's called insulin resistance. So you're actually maxed out on how much insulin you're making, but your blood sugar has risen above that. That is insulin resistance. And there are stages to this. So there's what we call normal blood sugar, but you might be insulin resistant. Then there's pre-diabetes, which is insulin resistance, but your blood sugar is not in the diabetic range yet. So your blood sugar is higher than normal, but not in the diabetic range. And thirdly on the spectrum from normal to pre-diabetes is type 2 diabetes, which is severe end-stage insulin resistance. And insulin resistance does not occur in isolation, as I said, As insulin resistance worsens, as blood sugar gets higher for a longer amount of time, blood sugar tends to continue to rise. Cholesterol also rises. Blood pressure also rises, and general inflammation increases, and that affects your other hormones. So as blood sugar goes up, specifically testosterone goes down. And over time, with high sugar, high cholesterol, high blood pressure, your risk of heart attack, stroke, kidney disease and diabetic eye disease goes up. So this is what we're seeing in this chap. And what is particularly interesting with his testosterone is some men assume, or people, women, men, we all assume that low testosterone is related to aging, but actually obesity, insulin resistance, diabetes, all of these things are major causes of low testosterone. So being ill in any way, if a man is suddenly very ill, or even a severe illness like kidney failure or liver failure, or the things we've discussed, diabetes, cholesterol, blood pressure, all of these things are systemic illnesses, and it sends a signal to the body to make less testosterone. And that can be partly a reason why testosterone is low. So the case is specifically complex because he's stuck in this cycle. Is the low testosterone causing weight gain? His weight gain is probably making his testosterone lower, and it's this vicious cycle that he's stuck in. And when your testosterone is lower, you're less motivated to do anything. So a man with low testosterone just doesn't have the motivation to exercise. They're exhausted all the time. Weight can increase further. Muscle mass goes down with low testosterone. So even if they go and exercise, you just get muscle aches and you just don't feel like it, to be very honest. So what did I do in clinic with this chap? So firstly, it's super important to reduce his cardiovascular risk. I do not want this chap to have a heart attack or stroke, because those two things can kill someone. So that's looking at his blood pressure, maybe looking at cholesterol lowering medication, bringing down his hemoglobin A1C, which is the 3-month blood sugar average blood test that we do, and looking at his blood sugar medication. So even a 10 to 15% weight reduction, specifically losing weight in diabetes, can reduce blood sugar, cholesterol and blood pressure, and it can increase testosterone. So I referred him to a dietitian, I adjusted his medications, I started him on GLP-1 therapy, so specifically Mounjaro, and we discussed sleep and if there's any way he can adjust his work timings or find a way to work from home, give himself a bit more time to recover. All of these things will help. So thirdly and lastly, before I hand over to Sandra, we have investigated the low testosterone separately as well. I've done some extra hormone blood tests. I referred him to a urology colleague to discuss erectile dysfunction in a sensitive, holistic manner and see what medical therapies may help him specifically with regards to erectile dysfunction. And hopefully, as the GLP-1 therapy, Mounjaro kicks in and his weight comes down, hopefully his testosterone will improve and he will start to feel better. But he's had diabetes for so long, this may take 6 months, 12 months, maybe even a couple of years. So the most important thing is for anyone out there listening who identifies with this case, try and keep on track with your doctor. So turn up for your appointments, book your blood test, do your blood test, and have an ongoing discussion. You won't expect miracles overnight, but we have to be in this for the long run together as doctor and patient. All right, Sandra, I know this is a special area of interest of yours. I know you coach men in midlife. So
Yeah.
What did you think when you heard this case, when I told you about this case and everything that I've said so far?
First of all, I think, from a holistic perspective, there's type 2 diabetes for 8 years. That's quite a long time, isn't it? And that means that this person has almost been, I think, in a loop and survival mode. You talk about the long working hours, stressful job, was it 2 to 3 hours, commuting between Sharjah and Dubai? It's soul destroying. Literally.
It is. That drive, for anyone that doesn't know.
If he's sort of a 9 hours or 8 to 9 hours in the office and then 3 hours either side, that's quite a lot. And I'm guessing as well that, during that time, is also probably going to be sort of snacking and finding something and self-soothing
You're
and all
so
sorts of
right.
things
He told
whilst
me,
being in that drive. Yeah,
actually, he told me he has breakfast in the morning and then on his drive he grabs something else from a drive-through. You're absolutely right. I
exactly.
forgot to mention
Yeah,
that.
yeah. So I think that somewhere within that sort of like, I don't know, that habit, he's just forgotten to actually invest in himself. He just probably can't actually get to grips with, thinking, right, I'm going to sit in a 3-hour drive and have myself a nutritious breakfast in the car. I don't think that's his thought process right now. And I think with men, from the discussions that I've had in my focus groups, they just feel like once they get to a certain age that, oh, well, tiredness, weight gain, low libido, it's just part of, it's just, you're just getting on, you're just getting older. And also, society, as you and I know, has taught men not to reach out for help, okay? It's not the manly thing to do, so they continue to push through, and then all of a sudden, body sends signals, and that's when they're coming to see you, because, it's more than just sort of like not getting a few hours sleep. It's a whole kind of snowball effect of different things: weight gain, low energy, poor sleep, everything, and then the lack, the lower confidence and stuff. So these are not just affecting their body, they're affecting relationships, they're affecting their self-worth, performance at work, no doubt, and just in general their quality of life. So for me, my role isn't to sort of sit there and point the finger and go, well, you should have done this. For me, it's kind of sort of saying, when was the last time that you prioritized yourself?
Yes.
Without feeling guilty? And, that lands quite harsh on some men, because the men that are doing it right, they're seen as the providers, okay?
Yes.
They've got to bring the income, they've got to sort of be the strong one in the house, they've got to be the, if they're senior level at work, they're managing teams, it's all high pressure and so forth. So taking time out to just take care of oneself sometimes just feels like an indulgence. All right, so I do see a lot of men, they throw themselves in the gym, which is fine, but then I also, these same men that come to my meetings and they look sort of like fit, still mentally are not great, still have got the sugar cravings, and still have got feelings of, lack of motivation and so forth, this, that and the other. I think the gym is just the one thing that they feel is the thing that they can do, but they're not actually addressing the root cause underneath. And I've seen some guys, the internet is brilliant with all these like trends that come out, like get up at 5 a.m, splash your face with ice, read 1,000 pages, do that, do that. But if you're overwhelmed, you just can't do it. I see so many guys that start it, and by week 2 or 3, it's just too much. So again, like the last case that we discussed, last week, it's really not about suddenly dumping a whole load of instructions on someone. It's kind of saying, okay, what can we do? A small, meaningful, mindful habit that you think you can do, that is a feel-good habit. It really needs to be a feel-good, Not everybody wants to read a book, it's just not them. But it might be that, sitting outside and watering the plants and, I don't know, doing whatever it is, it's for them. So it's not about us sort of just dictating, well, you should do this, well, you should do that. On the medical side, of course, but on the holistic side, it's let them make the decision of what would feel good for them, what would be manageable to them to fit in. And let's say that, this guy has got an intense journey and day, but let's say that we started off doing that once a month. Could we start moving it to twice a month? Could it become a weekly thing? Could we bolt on something else? Because, as I mentioned last week, these small habits compound.
Yes.
And they are decisions that the person themselves are making. you know, and they're measuring themselves. And then with that, because they're taking that responsibility and they're taking it into their own hands, that then becomes the feel-good factor, the confidence builder. And with that, as it compounds, you also see the results. So that's what I would be looking at. With this, I'd also be looking at, again, I talk about this a lot, regulation, you know, managing your stress, regulating your nervous system. What are they doing to be able to do that? On a long commute, I'm assuming that they're listening to the radio, maybe some music, but could they listen to a soothing podcast? I'm not saying one that's going to send them to sleep, but at least something where, you know, there's lots of fantastic podcasts and at the moment where
including
they've got binaural beats, and you know, they're there to kind of stimulate certain things within the body and or soothe like the vagus you know, or nerve, or all sorts of different things. So just by listening, you know, switching off from, say, some music, which is not always the best for us, but to something like that, could really, you know, make the journey a little bit easier. You say that he sits at his desk a lot. You know, perhaps when, you know, a lot of companies, you know, they have cigarette breaks. Well, when that person is having a cigarette break, why don't you perhaps take a little walk around the block? You know, you are allowed to move away from your desk. And I think that when we're in these scenarios, and I've been in those scenarios myself, where it's a stressful office, you know, sales are needed to come in and targets are there, you just feel that if you're not necessarily performing at your best, you just better just sit at your desk, and you better not take a lunch break, and you better not do that. Actually, no. They are in your contract that you are allowed to do that. So, you know, take a 5-10 minute break and clear your head. You know, go and sit in a quiet corner maybe, or even, I don't know, just, you know, up and down the stairs a few times, just kind of like just releasing stuff. Go and take that lunch. Maybe you don't want to take an hour, but make sure you take lunch, and, you know, weather permitting, walk to that lunch or eat your lunch, and then take 10 minutes of walking it off, you know, like, and just incorporating that movement. You mentioned that he says, like, on the way to work, he has his breakfast first and then he goes and gets his snack. And I'm assuming that that's probably almost like an emotional eating thing.
Yeah.
You know, he's probably not hungry if he's just had breakfast, but it's kind of that habit that he's got, that, oh, I'll grab a snack. And we talked about it like before with, is that the self-soothing snack because of the journey. And so can we switch that around? Can we change that into something else? Whether it's a healthier snack or whether it's perhaps chewing some sugar-free gum whilst listening to something that is more soothing and can get him through the day. Just looking at those kind of patterns. And then boundaries. I will talk about boundaries all the time, because sometimes the boundaries are just in our head. It's fear. Oh, I better not do that because I shouldn't do that. And so therefore, when people see you don't have boundaries, they just abuse, they just stamp all over them. If you can start to confidently look at where you need to set some kind of boundary and where you set non-negotiables for yourself, it's very empowering. It's taking back a bit of control. So I would be asking him to have a look at where they may be, you know, maybe even when he gets home, and it could be that rather than just having to dive straight in and do stuff with the children or dive straight in and do X, he could have a conversation with his partner and say, look, when I get in, I just need 10 minutes shut down, if that's okay. Do you mind? And she can inform the children and say, look, you know, Dad needs the 10 minutes, don't bother him with anything, just let him have his moment. And again, it's almost like taking back the control, reducing the overwhelm, and then from having that, then tends to come, oh, I've got a bit more energy to do X. So I would look at that. And then really, I think it's kind of sort of saying, you know, what is one thing that you could do that your future self would thank you for? And that can be anything. It could be, you know, going back to a hobby that you used to do. A lot of the guys that are in my focus groups all used to do something. They always say, yeah, I used to do this. Whether it was, I used to play football, I used to DJ, yeah, I used to do this, and they've stopped. But it's like, well, why have you stopped? There are 24 hours in a day. Yes, you may have to structure a little bit, but if it's a situation of you used to play football, there are football teams around right now. There are, you know, mature football teams. No, you're not playing Premier League or anything like that, but they're still there. Because it's not just about playing football at a high level. It's the social aspect. It's the camaraderie. It's the team. It's, do you know what I mean? It's, you know, using your lungs and having that feel good. And the body, as I talk about a lot, remembers. So why not go back and do that? Or if you used to DJ and stuff like that, why not start pulling out those old, I don't know if they've got compact discs anymore, they probably don't, but why not go back to that music again? And why not, like, you know, music is so powerful. And, you know, I'm in my 50s and I still listen to some of those rave tapes from back in the day, and when I'm sort of like around the house, cleaning the house and everything, and I stick one of them on, it really travels through my body. I feel like Superwoman. I'm going around at 200 miles an hour, like bopping away. So yeah, I think it's just kind of like going back to some of those things and remembering who you are. You know, remembering who you are. You don't just disappear. Do you have to do things maybe a little bit slower sometimes? Yes, but you don't have to stop everything. So that's how I would be looking at this gentleman. And then I guess when we talk about, you know, medicine and lifestyle together, and this is like, you know, why you and I do this podcast, right? Yeah. Is because the transformation happens so much more quicker. Yes. If you was to have two patients with exactly the same symptoms, they're the same age, you know, the same concerns, and one of them just took the meds, went home and just carried on doing what he was doing, and then you've got someone else who actually has got the meds but has got someone saying, you know what, why don't you do a bit of that? Yep. And you know that stuff that makes you feel really good, why don't you try a bit of that now? Who is going to come back to you with the better results?
Absolutely. You are the second patient, of course. You're absolutely right.
Yeah. So I think that, you know, always going, and, you know, if there's any concerns, and if someone came to me first with certain concerns, the first thing I would do is go and see a specialist, get everything checked out. You know, can't make assumptions, and this is the problem with the internet sometimes. You know, people grabbing all sorts of information, which really can be damaging if it's not the right information for you. So go and get everything checked, then come back, and then let's have a look at what we're working with and how we can get you back to being you as fast as possible, and you taking back that control. So, you know, the coaching isn't me just tell. It's showing you that you can actually, you know, get your control back and enjoy getting that control back as well.
That's so awesome. So well summarized. And I know that you have a specific interest. You've told me so many times about midlife men's health, because I think the narrative right now is so much focused on women's health, and rightly so. Rightly so, because that has been ignored from, you know, mainstream media and medicine, and so many other things have, you know, been unfair to women's health over the years. But we mustn't forget that we are only 50% of the population, and until men and women's health improve, you know, one party or the other is at a loss. So we all need to try and improve together. So I'm going to give my take-home messages specifically about testosterone. So testosterone blood tests, you know, men ask for it all the time. What I will say is there can be huge variability in the testosterone hormone blood test. Some men can have totally normal sexual function and no symptoms with a very low testosterone. I've seen that many times. And some men, feel really low with a, high normal testosterone level. So the testosterone blood test is not a very good marker of what is happening in the man. The other thing is we have no real way of telling how that testosterone is acting at the level of your cells. So there's a lot of variability in the way men respond to their own testosterone. So when you get a testosterone blood test as a man, you have to kind of interpret it in a bit of a kind of grey area way of thinking. So men want to know what their number is. Men have that kind of mindset of what's my number? And often that's not so helpful. And a good doctor, a good endocrinologist will explain that to you. So that's one take-home message. And the second take-home message is really, it's so important to exercise when you have low testosterone. It can increase your testosterone levels dramatically. I've seen that many times. So those are my two take-home messages. What's yours, Sandra?
I think that for this, if we're going on testosterone, I'm with you in terms of, I think there is, men get fixated on just a number, and then they think, oh, if that number's okay, then I'm fine. But it's not always that way. And also, what I will say is that I think there's not enough information out there about it, because when I've had conversations with men, and two men in particular I can think of, and the word testosterone has come up, they've kind of recoiled about it and gone, oh, because they feel like, oh, this must be like an anabolic steroid, and this must be for those guys that just want to jab a needle in and just whatever. And it's not. You've mentioned yourself, it's almost like this loop, isn't it, that low testosterone can be causing obesity and diabetes, and the other way around, diabetes and obesity can cause low testosterone. So I think it's quite important for men to be able to feel comfortable and confident to go into a medical practice and say, I'm feeling like this, could I just get these things checked out? When it comes to hormones, it is predominantly focused on women, and we really should also talk about it to men as well. For this gentleman that we're talking about on this case, coming at it at a holistic level, I think that what I would say is that before he gets in his car, is to really just kind of like pause, take a breath, and just ask himself, like, what can I do different today that by the end of the
That's amazing advice. Thank you so much, Sandra, for this really enlightening discussion, and thank you to all of our viewers. If you have a case that you want us to discuss, please comment or send either of us a message. We'll keep it anonymous, and make sure you subscribe and like and share this episode with anyone who you think may benefit. I'll put more details in the caption below. Many thanks.